The Brawl Stars Club will meet every Thursday in Miss Overbaugh's room, 3217. The Fellowship of Christian Athletes will meet in room 1226 on Thursdays. All are welcome. The National English Honor Society meets the first and third Thursdays of every month in Miss Barr's class, 19127, with meetings at 6:25 a.m. in the mornings and 2:05 p.m. in the afternoons.
As a baby, you learn to speak at your own pace. Some people learn slower than others. Some need help to remember when they're older. Some need help due to medical issues. Speech therapy is a surprisingly common service to use when going through trouble with speech. Today, we are interviewing a speech therapist on how these methods can help students.
As a speech therapist, we're basically experts at communication. We evaluate and treat patients that have problems with expressing themselves, their ability to understand information, sometimes even swallowing, voice, working on patients post-stroke, all these kinds of communication challenges that somebody might have, or even brain function challenges.
Speech disorders occur when a person has difficulty producing speech sounds correctly and fluently or has problems with their voice.
If we are trying to evaluate and figure out what a child needs, we do certain tests. So we have assessments that we use for speech and language. We will test them on different areas of speech and language. We'll ask them questions. We may have them say certain words that have certain sounds in them, and then we listen to them, we watch them, and we see if it's normal for their age based on a score that they receive. Is it not normal? Are they having problems with their speech because something in their mouth is not working correctly? That kind of thing.
A 2012 study showed that nearly 1 in 12 U.S. children ages 3 through 17 has had a disorder related to voice, speech, or language in the past 12 months.
So with students in academics, there may be other kids that struggle with communication. They may not know how to say something, what to say. It may not sound like it makes sense, and that causes problems in academics. If you can't spell, if you can't say things correctly, you can't make a speech. You may have a hard time creating an essay or writing out something because you don't know how to use words in a sentence.
In 2011, researchers reported that after monitoring over 700 children in speech therapy for 6 months, they saw large improvements in their speech and language use.
Some common misconceptions, I would say, are we only work with kids. I also would see that people think just because somebody stutters means they need speech therapy, or if a child can't say their sounds, that's it. Like, they don't realize that we do so many other things, like voice therapy, that I work with patients that have problems with their vocal cords, or a patient that has a feeding tube and they can't swallow food. Like, we've done work with that too. So it's a lot of misconceptions out there about what speech therapists do.
Thank you so much, Ms. Allen. Speech therapy is an extremely useful resource that helps many people, young and old, every day. I'm Megan, reporting for ENN.
Speech issues that can be treated with speech therapy almost are never the patient's fault. Not only that, but not everyone has the resources to go through speech therapy. For this reason, you should never mock or really tease someone from their speech disability. This kind of bullying can lead to a lot of decreased confidence or increased anxiety that kids who need speech therapy might have. Overall, the message is that you should speak up for those who are not confident enough to speak up or unable to speak for themselves. Everyone's voice deserves to be heard. I'm Bayla, reporting for ENN.
Now that we talked about the pros and cons of speech therapy, let's go to some interviews to hear their opinion on why they think kids should take speech therapy.
Personally, I think that it would help kids who are struggling with speech get rid of their stutter, be more confident in front of people, get rid of stage fright, and overall just help them in general.
Kids that do have like a speech impediment, they should have like a class for like speech. It helped. I actually had to go to one when I was younger. I was learning the language and I could not speak. So I do think classes that for speech therapy, it would help. I had to take one, so it works.
And I think kids shouldn't really have speech therapy because I personally have a stutter and I never took speech therapy, and it's just like getting better as time goes. It's like if they get to an adult, then they should, if it's still there, but kids not.
Thanks for your opinions. I'm Haley, reporting for ENN.